1 out of every 5 people will suffer from depression at some point in their lives. Moreover, once a person has experienced a depressive episode, they have a 50% chance of experiencing another depressive episode. This figure shows the incidence of depression in people 12 years of age or older in the United States during a 2007 to 2010 National Health and Nutrition Examination Survey. As you can see, about 8% of the people in the survey reported current depression. The term depressed gets thrown around a lot in casual conversation. We've all overheard things like, my DVR didn't record the new Game of Thrones, I'm so depressed. But in a clinical sense, what exactly is depression? Depression is categorized as a psychological affective disorder and is characterized by a number of symptoms, including overall sad mood, severe weight change, difficulties concentrating and a lack of focus, fatigue and sluggishness, a lack of interest in activities that were once enjoyed, changes in sleeping patterns, changes in activity levels, feelings of guilt or worthlessness, and recurrent thoughts of death and suicide. Though many of us have times where we feel down, the Diagnostical Statistical Manual criteria for a diagnosis of depression requires that 5 of these 9 symptoms be present most of every day for at least 2 weeks, and that the symptoms be present in the absence of other causes such as bereavement, a medical condition causing depressive symptoms, other psychiatric illness, or drug and alcohol abuse. Even within a diagnosis of depression, the levels of severity can range from mild to moderate to severe. Depression can have negative impacts on interpersonal relationships, work performance, and can result in missed days of work and even job loss, which can further exacerbate depressive symptoms and make depression costly on both the individual and social level. In severe cases, depression may lead to self-injury or death by suicide or complications due to drug and alcohol use. Given the severity of its effects to the individual and their family as well as society as a whole, and because of its high prevalence, you can see that depression is a serious health concern. In modern history, depression has been treated in a number of ways. Early psychodynamic treatments relied on talk therapies. The first antidepressant medication, imipramine, was introduced in the 50s and was considered to be a magic cure for depressive symptoms. This drug was quickly followed by tricyclics, and many antidepressants have been introduced since, including the widely known selective serotonin reuptake inhibitor, or SSRI, Prozac. Antidepressant medications work by altering the neurotransmitters in our brain that control for mood, pain, and other sensations. The drugs either cause an increase in the release of neurotransmitters such as dopamine or serotonin, or block their reuptake, causing a flood of these chemicals within the brain, such as in the case of SSRIs. Though many of these psychopharmacological treatments have proven very successful, they can also have a variety of negative side effects, including sexual dysfunction, addiction and abuse, weight gain, fatigue, risk of overdose, and in some cases, increased risk of suicide. As such, psychologists have long sought effective and empirically validated non-pharmacological treatments for depressive symptoms. Among these alternatives are the behavioral therapies. The first behavioral therapies were introduced in the 50s and popularized in the 60s. These first-wave behavioral therapies relied heavily on the use of classic and operant conditioning techniques, and the focus of the therapy was on learning behavior and on the use of positive and negative reinforcement. The second wave of behavioral therapies became popular in the 70s and relied on similar strategies of conditioning, but also focused on information processing and relied heavily on the use of cognitive techniques, wherein patients were tasked to change negative cognitions regarding their emotional states and internal thoughts. More recently, a so-called third wave of behavioral therapy has been introduced, and their research is in its infancy. It has shown to be successful in the treatment of depression and, perhaps more importantly, the reduction of recurrent depressive episodes. This third wave of behavioral therapy differs from cognitive behavioral therapy in that it does not focus on changing cognitions. Rather, it relies on methods of attention and focus on the moment and the reduction of ruminative thoughts about the past or the future, thoughts which are highly correlated with depressive symptoms. These methods are rooted in the Buddhist practice of mindfulness, which engages thoughtful and non-judgmental awareness of the present experience, which has a negative correlation with depressive traits. ACT is one such third-wave behavior therapy that is showing success in patients with depression. The theory behind ACT is that there are some main psychological processes that are central to psychological distress. They are cognitive fusion, or the way in which we attach feelings to an event, experiential avoidance, or an attempt to avoid thoughts, feelings, and memories, an attachment to verbally conceptualize self or past, or the internal language that we use to help us make sense of our experience and our emotions, a lack of values or confusion with goals with values, or an absence of committed behavior towards living by these chosen values. So what is ACT? ACT stands for Acceptance and Commitment Therapy. Acceptance, in the context of this therapy, refers to the treatment's incorporation of methods of mindfulness in its approach and teaching acceptance rather than avoidance of negative and uncomfortable internal experiences. The inclusion of the term commitment in ACT refers to the defining of one's values, such as empathy, compassion, and gratitude, and the commitment towards behaviors that support living a valued life. ACT, and specifically the acceptance and mindfulness aspect, has building empirical support for its efficacy in the reduction of depressive symptoms. In one study of adolescents exhibiting depression, participants were divided into two treatment conditions, one receiving ACT with an emphasis on mindfulness, or a treatment as usual condition, or a TAU condition. Though the two conditions initially showed similar results with regard to a reduction in depressive symptoms, those in the ACT condition required fewer sessions and showed a greater continued effectiveness at a 3-month follow-up than those in the TAU condition. This suggests that ACT may be more efficient on both the individual level as well as the cost level than other treatments and may have longer lasting results. As a further benefit, in the same study, the attrition or dropout rate was significantly lower for those in the ACT condition than the TAU condition, suggesting that ACT and mindfulness are perhaps easier for patients to integrate into their daily lives, and so they may be more likely to follow through with their treatment plan. This observation is supported by further studies showing that lessons in mindfulness need not be presented in the form of traditional therapy sessions in order to be effective. In one study, participants who were assigned to a mindfulness-based yoga program showed reductions in baseline depressive symptoms over those assigned to a waitlist control group. Because those in the study showed only minor depressive symptoms at baseline, it's possible that mindfulness-based leisure activities such as yoga classes could offer protection against initial onset of depression symptoms, particularly in at-risk groups such as college students, cancer patients, and chronic pain sufferers. Further research has shown that ACT mindfulness-based therapies are effective in reducing the reoccurrence of depressive episodes, particularly in those who have suffered 3 or more major depressive episodes. In many of the studies, psychopharmacological treatment groups fared as well as those in the mindfulness groups. However, given the possible side effects as antidepressants, as discussed before, it's likely that clinicians and patients will prefer mindfulness-based approaches. Values interventions in ACT rely on the common sense theory that one cannot have both a negative affect and positive affect at the same time, and the empirical supported theory that in defining and living in accordance with one's values, positive affect is naturally increased. Although there's a lot of research to be done, the information so far is promising. Because ACT shares its foundation with behavioral approaches, it's natural that its interventions require practical behavioral change. This brings in the value-based interventions, wherein the patient is tasked to identify their personal values as separate from their personal goals. Their values, in this sense, are the things that matter most to the patient. Once the patient has defined these values, the therapist and patient work together to outline behaviors that will support living a life according to these values. Research has found that participants who were required to first identify and then were reminded of their identified values showed a higher tolerance to pain and reduced anxiety levels. As acute pain and suffering and anxiety are positively correlated with depression, these results are very promising. This area of research is garnering a lot of attention and promises to produce unique insight into profound new structured, empirically supported, value-based treatment interventions in depressive patients. In summary, we've discussed the nature and symptoms of depression as well as its prevalence. We discussed the history of depression treatment through its paradigm shifts as well as its medical advancements, and we discussed the progression towards more personal accountability in therapy and depression recovery, such as in the behavior approaches to therapy. We also discussed the 3 ways of the behavior movement and psychological treatment, and we discussed the 3rd wave of behavior treatments, which incorporate the usefulness of past behavioral approaches while recognizing the value of pharmaceuticals and at the same time advancing a more holistic approach to depression treatment and prevention. Specifically, we took an in-depth look at ACT with its focus on the here and now and its in addition to its attention to identifying values and giving meaning to a person's life, and its encouraging research results thus far. I hope that this presentation has helped to illuminate for you some of the current alternative treatments for depression, as well as to help you see that further research in this area could have widely beneficial results for those suffering from depression, as well as society at large. Thank you for watching.